personal experience. I have done it. In fact, this is a pre-operative deformity. The deformity is recurred and corrected with the laser off with a small incision, and that is the result. This is another patient who has got this deformity. It's after the trauma, multi-angle deformities corrected, and this is the patient is walking now. He needs the knee bending. Another patient, post-traumatic, walking. He's not doing anything for the 4 months or so. In fact, he's stopped the stop. Another patient, listhesis. And these are the results. Another girl with this much deformed, 10 years old. You can see the spinal cord status, more rising like this way, going up toilet or fixed with this thing. Did the posterior vertebrectomy, hemivertebrectomy, corrected the both for deformities. The question was always this thing, can she walk? And she could walk. Now she is married as well. Other deformities like osteoarthritis, severe deformities. This is the knee replacement. One side is the knee replacement, other is the high level osteoarthritis. This is the video after the 6th month. Other patient with the gross deformities corrected with the high level osteoarthritis, and this lady is walking. Other patient is like a common question with the hip replacement, how long this will work? I say for the lifetime. And these are the results. Patient is farmer. I express my gratitude to Professor Pankaj Khandwal, additional Professor Vivek Singh, and other members of the organizing committee of the Uttaranchal Orthopedic Association for giving me an opportunity to share my experience among all of you. I would like to tell you from the beginning that if any of you take even a percentage of my message, then I consider that my purpose of coming here has been successful. I always believe very strongly over here that any thoughts, जैसे पौधे को पानी की जरूरत होती है, उसी तरह से विचारों को प्रचार प्रसार की जरूरत होती है। यदि पौधे को पानी ना मिले और प्रचार प्रसार विचारों को प्रचार प्रसार ना हो, तो दोनों ही मुरझा जाते और मर जाते। Then they don't serve any purpose of all this. Human resource is the greatest resource on the planet Earth. We also strive to develop this resource. Health, not only an asset but also a resource which must be nurtured, and I write the column in the Pioneer very regularly. That's what I say. Health, education, nutrition are the basic needs of the life. These all needs can be fulfilled only with the application of the human behavior. Human behavior is expressed or potential capacity for all actions, whether physical, mental, social, professional activity during all phases of life. And key to success is a triad of behavior, knowledge, and skill. In respect to the profession, a triad of behavior, knowledge, and skill is key to success. It is more important in medical profession because we are dealing with the human. Now I will confine myself to our professional work only. Here, I would like to share my surgical experience with you with a 2-minute video as I have shown it earlier. As I mentioned earlier, behavior plays an important role for the growth of all humans in respect of the age, caste, creed, gender, region, and religion. We all learn a lot from the environment. In fact, we are the product of the environment and the society. All problems of our life are influenced by each other behavior. I personally feel behavior is an art as well as science. If your behavior is pleasant, it is an art. Researchers show that a smile is literally infectious. If you recapitulate Newton's law of action and reaction, it is a science. Most of interpersonal problems are created by bad behavior, and most of the problems can be solved with the good behavior. Human behavior determined partially by the individual rather than solely by the environment. The success breeds the success. It looks like one chooses a doctor or specialist for his knowledge and skill, but in reality, one chooses one's behavior. The behavior matters the most and comes first before knowledge and skill. Human behavior accounts for action using knowledge and skill. We all can reap the fruits of our action through behavior only. The behavior works as a vector for an application of knowledge and skill. This vector has both magnitude and direction. Communication is an important part of the behavior. It is the communication only by which we can express our feeling, thoughts to others to fulfill our desires. Communication is defined to convey the idea to others. Therefore, communication skills are needed to express the feeling, to inform and to influence the others. In communication, two things are very important from my point of view. One is the medium of the communication, that is the language, and other is the message, what you say. In speaking, care must be taken, not only what you say, but also how you say. I would like to recite a poem titled Akshar from my poetry book Upahar Sandesh ka. Akshar, I love you baby. अक्षर तो वही है, आंखें बदलती हैं। I love you baby, अक्षर तो वही है, आंखें बदलती हैं, पर आंखें बदलने से अर्थ बदलते हैं। I love you baby. It was Albert Mehrabian, an American psychologist, who found that the 90% communication is non-verbal, only 7% is verbal. If we want to bring any change in any person, then I believe there is need to change his thought process, because thoughts are the primary source of all action. People learn, understand and behave all because of the information and ideas they exchange through communication. Active communication is characterized by a continuous cycle, sender and receiver. In fact, communication is a cyclic process. Thus, basic components of the communication process include senders, selecting the channel, receiver, decoding and response. Decoding means understand. One can only understand if the medium of communication is same. I mean to say the language. If the language is same for both sender and receiver, then the person will understand the best. भाषा संवाद का एक माध्यम, पूरे जीवन यात्रा का साधन, परस्पर जीने का आधार है। भाषा एक विकास एवं सम्मान का साधन है, तो विनाश एवं अपमान का भी, क्योंकि भाषा कारक है हर घटना की। भाषा ही हम सबके भविष्य की रचयिता है. This is also taken from my poetry book, this is the first copy which I gave to the Vice President Naidu. Here, I would like to confine myself to tell how human behavior affects the professional activity. There is significant difference between the medical and manufacturing work. Surgical work is considered to both service sector and manufacturing sector, as we deal with the patient and the surgeon. And surgical results are the final product of the surgeons. Now in coming slides, I will elaborate in detail what I do in my practice. To apply the behavior, we need first the contact with the patient and their relatives, then communication with them. As soon as patient enters room, I greet them by saying Namaskar, irrespective of the caste, creed, religion and caste. नमस्कार करने से कुछ घटेगा नहीं, पर बदले में मिलेगा पद, प्रतिष्ठा, प्रशंसा, पैसा, प्यार, प्रोत्साहन, पुरस्कार. Then I start communication, usually in Hindi, rarely in English, because I think a person knows the English, then I am sure he must be knowing the Hindi as well. I believe thoughts are the primary source of all action, and communication plays an important role to transfer the thought and to transfer an individual. Thought is the primary source of all action, and I propagate wherever that an opportunity. I usually deal with the complicated and difficult high-risk patients who are prejudiced, like many others, about their problems and the doctors behave. As it is said that दूध का जला छाछ फूंक कर पीता है. Prejudiced opinion can be minimized if different groups were made to talk with each other. If sometimes few people either do not understand or some are more enthusiastic to inquire a lot about details of surgical procedure, then I show them a piece of paper which is on my table written in Hindi. आम खाने से मतलब रखो, पेड़ गिरने से नहीं. I have seen after showing these two lines, most of the time they understand and agree to the treatment what I suggest them. Next problem comes about the cost of the treatment. I personally do the surgery in lump sum amount. Why I am following this principle? Because my setup is small. Not many staff to maintain the inventory and account. It saves time and avoid tension for both me and patient. I will quote an example. Suppose I am doing any intraocular procedure, and if we find in post-operative X-ray that reduction is not perfect, I do it again and do not charge additional for that. So, if one surgical procedure needed or many surgical procedure needed, I do all for in the same amount as long as it is needed to get the desired results. As I strongly believe, ant bhala to sab bhala. I have also given an acronym draft principle, that is do right at first time, because repair and redo are costly affair. Whenever I do any surgery, I remember this acronym. It is written in one of the OT ward. Similarly, the choice of procedure, number of surgery, the choice of implant, whether it is external, the right of decision regarding the surgery, duration, hospitalization, reserved with me only. I always tell the patient and their relatives, in the addition to them, if you have unequivocal faith and trust in me, then you do come to me. If you have any doubt, please don't. मैं हर्षिल के खानदान का तो नहीं हूं, पर झूठ कम बोलता हूं और मनसा वाचा कर्मा के सिद्धांत पर विश्वास करता हूं. That means there is no disharmony among my thought, words and deed. So there is no tension to me, and if you believe in that, there will be no tension to you. I also believe in seeing is believing. It is proved scientifically by Alport that people will pay 50% more for an item of junk food if they could see in front of them. Because pratyakshe kim pramad. I would like to say certain things about the money or the expenses. I believe in philosophy of Charvak, who was the Indian philosopher who said, Yavat jive, sukham jive, ranam kritta dhritam. That means if any amount is spent on the health, that is but because health is wealth, and I also tell to the patient that jaan hai to jahan. And I strongly believe health is not wealth, it was, but now wealth is health. Because time is not permitting, and thank you very much. I once again give the thanks and express my gratitude to the organizing committee. Thank you very much. Namaskar.